Friends, I am Dr. Sujit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 homeopathic remedies for hydrocele. What is hydrocele? Hydrocele means water. Hydro means water. Cele means thin walled sac. Hydrocele means collection of fluid in scrotum, that is thin walled sac. More specifically in sac of one or both testicles. Generally it is painless. What is the incidence of hydrocele? About 10% of male newborn babes have hydroceles which spontaneously recover in a year. 1% of adult men are affected with hydrocele. What are types of hydrocele? Number 1, communicating hydrocele. Hydrocele having contact with abdominal fluids. They grow rapidly in sizes, often requiring mechanical intervention. Number 2, non-communicating hydrocele. Hydrocele having no contact with abdominal fluid. These generally remain fixed in size, grow very slowly or dries up. On the right hand side, there are healthy testicles and hydrocele. So this is the accumulation of fluid, this yellow portion, and this is the testicle. This is healthy, this is unhealthy, that is diseased. What are causes of hydrocele? Causes depend on age. In case of a male baby, testicle develops near the kidneys in the abdomen during pregnancy. Before full term, testicle descends down to scrotum. To allow the descent, a muscle lining opens in the scrotum, inguinal ring, forming a canal. That has been shown here. This is the canal. Through this canal, this will descend to the scrotal sac. This side also is the line. This is a particular ring, inguinal ring. Once the testis reach the scrotal sac, the inguinal ring closes. Closes means it should be closed. But if it remains open or opens again, then fluid comes to scrotal sac from abdomen, forming hydrocele. After descent, if this is sealed or rather shuts, they shut up, then hydrocele cannot occur. But if it is not open, not shut, it is not shut fully or shut up, then again reopens. In both the cases, there is accumulation of fluid leading to hydrocele. Once the testis reaches the scrotal sac, the inguinal ring closes. If it remains open or opens again, then fluid comes to scrotal sac from abdomen, forming hydrocele. In older males, if inguinal ring did not close up properly or reopens, a communicating hydrocele can form. Can hydrocele be prevented? Hydrocele of babies is not preventable because this is beyond our control. However, hydrocele of adult is preventable to a large extent. If scrotum is prevented from getting injured, that is external injury, if you control external injury, together with scrotum must be kept protected with help of cup or highly tough yet resilient briefs. There are a few shown here. However, hydrocele is not 100% preventable. It is not 100% preventable. Does hydrocele pose any serious problem? Very, very seldom. In most cases, either they remain controlled or they recede on their own. In a few cases, surgical intervention or remedial intervention may be required. Hydrocele does not interfere with fertility of men. This is a very important point. Many think that hydrocele make a person non-fertile. Not. There is no interference of fertility with this. However, in modern allopathic medicine, there is no remedy for surgery. There is no remedy for this disease. Only surgical intervention is there with high rate of success. In homeopathy, there are a lot of remedies, of which only 10 have been described here. How diagnosis of hydrocele is confirmed? USG confirms diagnosis of hydrocele. On the right hand side, I have given a picture of ultrasonography. Ultrasonography of bilateral testicular hydrocele. Note, the black portion indicates the presence of fluid and the gray portion is the testicle mass. What are the signs symptoms of hydrocele? Swelling of scrotum, pain or tenderness may be or may not be there, heaviness in scrotum, uneasy and awkwardness. Now we are taking up remedies. Spongia for hydrocele. Testis swollen, red with throbbing pain, squeezing or stitches into spermatic cord and testis, genitals hot. This spermatic cord, this is structure, actually cord-like structure formed out of epididymis, blood vessels, nerve, etc., through by which the testis is hanging in the scrotal sac. That is called spermatic cord. Picture on the next page. Pulsatilla for hydrocele. Pain in left side, size of testis increases gradually. Testis hang low down, bloody emission, patient thirstless. Mind this particular testis means plural form of testis. Brownia of hydrocele for hydrocele. Congenital hydrocele. Troubles after overlifting. One expert says that you use 200 one dose a week. Calculate curve for hydrocele. Hydrocele of children burning with seminal emission, itching and burning in genitals, premature seminal emission. They like eggs and eggs very much. Calculate curve. So naturally they are very fond of eggs. Abridged for hydrocele. Hydrocele of malnourished children. They suffer from lentiria and marked emaciation of legs. Rhododendron for hydrocele. Acute attack, especially right-sided testis hard, swollen, tender. What's before storm, rain? Congenital hydrocele of boys, drawing of spermatic cord into abdomen. On the right hand side, the picture of spermatic cord demonstrated. As I have suggested, this cord-like structure, with the help of that cord-like structure, each testicle hangs in the scrotum. And this is made up of 3 or 4 structures like blood vessels, nerve, epididymis, etc. Arnica for hydrocele. Hydrocele from injury, seminal emission during caries. Hematocele. Hematocele means, as hydrocele means water, hematocele means blood within the testicle. There is injury, so it may be there may be some blood also. So hydrocele, hematocele, both case arnica is applicable. Importance from excess or abuse. Sulfur for hydrocele. Hydrocele with copious fetid smegma. Smegma, smegma is a some sort of excretory product, it is generally remaining in the penis, just beyond the rim of the head of the penis. Smegma, must have noted during some time while you open the penis, the foreskin. When you get the foreskin back, then you can see that smegma. Mind this, smegma is carcinogenic, so one must clear it every day during bathing. It is applicable for both sex, that is female and male. Smegma is also there in male genitals also. Discharge of prostatic fluid during urination or stool. Semen comes out on touching a woman, so sensitive, and touching a woman, semen comes out. Graphitis for hydrocele. Affection of left testis with pimples on skin. Edema of genitals. They suffer from spermatoria and constipation. Importance from excessive sex indulgence. These are increased with sexual debility. Salicea for hydrocele. Problems strictly worse in new moon or full moon. Sexual desire increases or decreases. Prostaturia from straining a stool. Extreme exhaustion from coition takes 8 to 10 days to come to normalcy. This is Salicea characteristic. So exhausted patient that if he perform coition, it needs 8 to 10 days for come to normalcy. Before that, he was so weak and prostrated. With this, the video ends. Thanks for listening, viewing. Anything you want to say or complain, anything, please write down in the comment section. I would certainly respond.